This video is going to discuss the CombiGuide in conjunction with photogrammetry. CombiGuide is a bone reduction osteotomy guide that's in the GuidedSMILE family of products, and it allows the doctor to place the implants precisely where planned and also complete bone reduction so that the volume of bone is reduced enough so that you have adequate space for long-term prosthetics, which is a shortcoming of a lot of surgeries these days. Not enough space for the final restoration, which leads to failure, the F word, failure. So let's go through the process of doing a CombiGuide. Now, these are the records, which is a full face, full smile. We like to see the photos of the teeth together in bite retracted so that we can make sure the case is articulated properly. And this, of course, can be a digital process. Upload your iOS scans or Stonecast. Either way, we'll work with either type, of course, and then capture a CT scan. This is a double arch, so this would have been a full volume, and then we'll separate. And then, of course, always a teeth apart if it's a dentate patient. What we will do in preparation for the CombiGuide design and the implant planning, because this is a photogrammetry case, we will complete a setup because we want to know about the tooth position for implant planning. We also want to know if we need to open the bite for space, and we want to have these teeth ready for when your scans come for the on the day of surgery. So we meet online, we send out the CombiGuide. This is it pictured here. The CombiGuide is a pin guide to deliver the fixation base metal, right? And then this is removed. The teeth are extracted and leveled down to a flat plane, and then the osteotomy guide is seated and the implants are placed. Now, what you see on the top right here is the first scan. So once the pin guide is removed and the fixation bases are in perfect spot, some do both at the same time if it's going to be a fast surgery, or of course do one, then come back and do the other hours later or an hour later, depending on your speed. Capture an iOS scan of the teeth and the fixation base. All right, you don't have to scan 360. I mean, you don't have to scan all the teeth, the lingual, because we already have the teeth and the bite back in the lab, right? This is where we have it. We already have it at the laboratory. So all you really need to do is pick up your breadcrumb, which is the fixation base. All right, rather than using TADs, you can use the fixation base. And we at the lab will roughen this up so it's very easy to scan. All right, so that's scan one. Then the implants are placed, and then you'll place the carrier guide, and it'll be a monochromatic carrier guide, not surgical resin. It'll be monochromatic like this. This is scan number two. So again, scan the fixation base because that's your breadcrumb, and put the carrier guide on or off. This is not required, depending on what scanner you have and how easy it is to scan. And then you'll traverse over to the healing collars, okay? And that means that the fixation base has preserved the bite, and then the healing collars are what we match up with the photogrammetry. So that's scan one, fixation base, scan two, fixation base and healing collars. Scan three is going to be the, in this case, iMetric, but we work with the pick, we work with the mapper, we work with the new Grammy that Blue Sky is selling, and believe there's others will be coming to the market. It's just folded a different way. It's like a lot of files that come in, just what you do with them. So we can work with any of these scan bodies. All right. So you complete that scan. That is scan number three. Right. Then this is an optional scan, but then you come back and scan the tissue and the MUAs or the healing collars, either one. We like healing collars because the healing collars can match back to these healing collars. So just go across here pretty quickly and give us the tissue level. There's a summary of the scans. Send these off to us. Right. We go back and we grab the pre-operative setup that we designed, the beautiful teeth. And then, so what we will do, in this case, the doctor performed the upper only, or the upper first, right? So we made the prosthesis, doctor printed it, seated it, and used it as the opposing right here. Okay, now the prosthesis that we made is in the mouth. Use it as the opposing. There's the fixation base. That's the first scan. And then we went through the whole process and made both prosthetics. Here are the prosthetics on the right side. Voila. Nice job. And there it is, CombiGuide with photogrammetry.